Hello and welcome, everyone. We see that everybody is still getting connected with audio, so we're going to wait just another minute, make sure everybody's connection is working, okay?
Okay.
All right, so it sounds like we have some audio going. If you could make sure that you are on mute, that would be helpful. And welcome to our very first of our 2021 lactation series for home visitors. We are so happy to see all of you here. If we can see all of your teeny faces. We will just get into it. I think we'll start off with some introductions.
Hit it, Hannah.
Oh, I'm going first. All right. My name is Hannah, and I'm going to be one of your co-presenters today. I am an IBCLC living and working in Los Angeles County. I currently work as the clinical director for BreastfeedLA, and you can see here on the right my beautiful family, very much my why in this work. And I think that's it. That's all I'm going to say about me, Brandy.
I am Brandy Jordan. I am a lactation consultant and a doula since 2001. I have a postpartum resource agency based in LA. And you will see here my family, my 3 children and husband, and just a big champion of breastfeeding and maternal child health altogether. So I'm so excited for us to be able to come and talk about this with home visitors who I believe to be the first responders when it comes to postpartum care and support. So I'm glad you guys are here.
So a little bit of housekeeping before we get too deep into things. You should have gotten an email. If you're all here, then you received our email that has some of our class agreements on it. We do want to make sure that you had a chance to read those.
Okay, go get your Gatorade.
And that you are able to agree to them. So if I could get everyone to give me a little thumbs up if you're on camera. Thank you. If you read those, and if you are not, great, Martha has us. You can find the little thumbs up in the reactions. I'm seeing people are finding them on your Zoom. Now, speaking of those reactions, we were playing with them earlier. There are celebration emojis, there are laughing emojis, there are thumbs up emojis, there are clapping emojis, and we encourage you to use all of them to interact with us as we move through this presentation, okay? I don't think that there's any thumbs down emojis. If you find one, don't use it, okay? We are recording this class. So as you know, we only opened up this workshop to 30 participants, and you were the lucky first 30. And after that, we had to close it, but we had a lot of interest from your colleagues, and we want to make sure that we are able to get this information to them as well. So you will be recorded during this workshop if you choose not to be on the recording. It's very, very simple. All you need to do is keep yourself on mute. And if you feel like turning your camera off, you're more than welcome to. But at this point, we are only recording speakers. So only if you speak will you be recorded. We do require participation. So we really hope that not all of you will be shy today. As you know, you have that mute button, that magic mute button. I'd like you all to find it right now. I want you to be able to know how to take yourself off of mute. I also really want you to know how to keep yourself on mute. Okay, so please make sure you find your mute button and you know how to use it. And also there is a raise hand function. So if everyone could navigate to that raise hand function right now and show me that you know where to find it, that's going to be the best way for us to figure out if you want something, if you have something to say. Perfect. Amazing. I'm seeing all of it twist around as you raise your hands. Feel free to lower your hand after you've raised it. That's really going to be the best way for us to keep the conversation going and productive as we move through this. And I think that's it. We would love to see your face. So if you feel comfortable at any point during this presentation and turning your camera on, we would love that. Brandy, do you want to go over the schedule for today?
Yes. I have 2 screens going. So first of all, welcome. I feel like everyone's like after lunch and just like, so welcome everyone. I'm glad to see some faces on my screen. I see Martha and Madeline and Lynette. That's all I can see on my little screen right now. But we're going to be talking about the anatomy of a virtual consult, which hopefully you knew that you were signing up for that today. If not, you're going to have fun doing it anyhow. And so we're going to be going through what it actually means to do that. And so for a lot of people, it's going to be learning about how to create a safe space beyond saying the hello, the highs, like really getting deep into what it looks like when you guys are used to going to people's homes, you know, inside their home, but even virtually, there is a sense of setting that safe space. We'll be going over that today, building rapport beyond asking someone how many kids they have and where they're from. How do you do that in this space that really helps to create that level of vulnerability that's necessary for you to actually be able to help them with whatever they're presenting with as it relates to breastfeeding and chest feeding. We're going to be talking about engaging clients. And so we talk about building rapport, meaning how do you get to know someone really quickly in a short period of time, but then how do you actually engage with them in ways that's going to make it more effective for you to be able to provide support, resources, to make it more for them comfortable to be able to share things that maybe they wouldn't have shared without you building that kind of space for engagement. We'll then take a little tiny break for you to kind of go and bathroom water, take a break from us and hearing us talk, and hopefully you'll be talking as well. When we come back, we'll be talking about angles for assessment. One of the questions that you're probably thinking that we get a lot is, how do you actually do breastfeeding or chest feeding consult when you're on a camera and not in person? And so we'll be talking about what kind of angles you need, how you can help them to achieve that in a different space. And that can be really helpful for you to be able to give the right resources and see if this is something that you can actually help them with, or should they be referred out for, you know, other services. We'll also be talking about the benefits of doing a virtual consult and doing it in the way that we're going to be teaching you today. And then we're going to end on special cases, which really is talking about, is this a situation that you can actually support them? Are there other people within your interdisciplinary team or outside resources that you should be helping this client to connect with? And that is our day.
Okay. And so now let's go over our learning objectives really quickly so you know what you should come out of this learning. The first thing, as Brandy said, was we are going to demonstrate how to create a safe space that is also productive for your clients and your participants. You should be able to identify ways to engage clients and participants in our virtual space, demonstrate how to build rapport with clients and participants, and identify the best angles and virtual techniques for accessing or assessing latch and positioning and milk transfer, and describe the benefits of the virtual consult and identify when in-person consults are necessary. So before we get into the material, we actually are going to do a quick activity. So for those of you who have your cameras on, and I guess for those of you who don't, I'm actually going to stop my share so I can see you a little bit bigger. How many of you have taken the lactation education class with me before? Anybody? No, nobody? Okay, good. Then this will be a new activity for you. How many of you are at home? Quite a few? Okay, at least some of you are at home. Fantastic. So before we get into this activity, I always want to state, before any activity, you always have the opportunity to opt out of this. If this in some way offends your senses, offends your culture, offends your afternoon in some way, or you just don't feel up to it, you have the ability and the right to opt out of any of the activities that we're doing today. These are really for you, and you will be able to you'll be able to see the benefit of the activity afterwards during our discussion. So we're going to put you in pairs right now. Jose, can you either make me host or can you open some breakout rooms for us?
Give me 1 second, all right?
No problem. And if you end up in a breakout room, so you're going to pair up, and if you're in a breakout room with somebody who doesn't show up, or somebody who wants to sit this one out, you can just come on back to the main room and chat with Brandy and I for a little while. Or you can sit in that room by yourself and take a couple deep breaths and take a moment away from work. Okay.
Do you want 2 people per breakout room, Hannah?
2 people per breakout room. Don't open them just yet, okay?
Okay.
Awesome, thank you. So what you're going to do when you get into those breakout rooms is one of you is going to ask the other one, can you please show me into your refrigerator? And so if you are mobile, it will work out well. If you have a laptop, this will work out well. If you both have desktops, I don't know how this is going to work out for you. But then the other person is going to take you into their refrigerator and show you around a little bit. Okay? And yes, some of you are in the office, so you're going to have to sit this one out likely, or maybe you'll be with someone who's at home.
Show them inside their desk drawers or something.
Or your purse.
Yeah, and your purse. That's a good one, but not everyone has a purse.
Not everyone has a purse. Your backpack. What are we bringing into our hospitals these days? I bring a backpack into mine. All right, you can open them up, Jose. We'll see you back here in about 5 minutes.
Some people are not happy with you right now. Talking about show me my
1
refrigerator.
second, Hannah. No,
Like, I didn't do my grocery shopping yet.
Zoom is being difficult. Give me 1 second.
Lynette says, I'm scared. I'm scared for y'all too.
Hi, Lynette.
Somebody has one beer, somebody has like all beer in their refrigerator. They don't want to show. No food, just beer.
We did this the other day in our class, and somebody had Cheetos in the freezer. She was like, I don't know. I'll tell you why. Let us know when they get open, okay, Jose?
Breakout room. Because it's only opening up 2 right now. I'm not sure why. And I know we don't want 2 breakout rooms. We want 13, right?
Mm-hmm.
Have fun, everyone.
Make sure you accept your invitation.
Some of y'all will be with 2, and there's 1 room with 3.
Jose, once everybody's settled, go ahead and move people around if there's only one person in a room.
That's what I'm saying right now.
Lynette's asking is there a way for her to join room 9?
Oh, she's logged in twice. Lynette, hi. We were just emailing. Nice to hear you. See you.
So I'm gonna move Monica because she's only in. And then Lynette wants to be in room 9, right?
Yes, please.
What other room is she in though? She's already in room 9.
But her other person, her actual person, isn't in room 9. So it'll be her twice in that room.
Like,
Yeah.
I don't know what's in there, so we'll see now.
Like, I just
Okay,
fixed my
so this
refrigerator,
is the
all
fridge.
organized.
Yeah, it looks like a cabinet. When people come over, they don't know where it is, which is kind of fun, like trick we play. Okay, so
Okay,
there's
what's
the
in there?
fridge. So
That
this is the thing that takes up the most space. It's the Brita filter. I never, my fiance is like big on thinking that our water needs to be filtered. I don't think it's that big of a deal, but
I'm with your fiance on this one.
yeah. I don't know. I'm always like, we got yogurt that was just bought yesterday. That's fresh. Random thing of kimchi back here. It's been back there for a long time, but it still tastes good.
Kimchi. Yeah, because kimchi can't go bad, right?
Right. Yeah. I think it's been in there like a year, honestly. It's like,
There might be some limits, Martha, but
maybe we shouldn't eat this anymore. Like we don't
I
even
mean,
eat
I'm gonna
it.
say it lasts a long time, but
That's a long time. It's like fermented though, right? It's
I have
gotta-
some miso like that. It's been here like 18 months, even though they say it's ready.
Yeah.
I have my doubts.
I'm like, I wonder if we should just get rid of this, but like neither of us want to do that, I guess. So
Did one of you make it?
what's that?
Did one of you make it?
No, we got it. Actually, it's my fiance's. I don't know where he got it, but it's in Korean. So I think he got it at like the Korean market or something.
Looks legit.
Yeah, it looks
It
delicious.
might be fermented and bubbling inside, but
It's supposed to be fermented and bubbling. It's supposed to be.
bubbling.
That's
yeah.
what makes it good for you.
Fermented, yes. Bubbling, no.
Yeah.
with Brandy on this one.
It's bubbling. There's some chemical reactions have started.
That's true.
That
Yeah.
part
It
was not
smells
part of the
good.
description.
Thanks for
Okay.
sharing your Martha.
Yeah, no problem.
Yes, thank you for showing us your refrigerator. We
You're
appreciate
welcome.
it. We have a couple of people that joined back with us, so you all got to see Martha's refrigerator too.
Yeah, I'm glad there were at least a few things in there. We just got back from, we were on a little trip over the weekend, so there wasn't anything in there yesterday until I went to the store. So now there's at least a little bit more in there.
She did her grocery shopping.
Know that feeling. Know that feeling well. Jose, you can go ahead and close those breakout rooms now. I don't love not having Zoom control. I'm having a letting go of control moment
Oh, because you're not. Why are you not hosting it?
because Jose's recording for us.
Oh, okay.
So he's going to control what gets recorded.
Jose's in charge.
Jose's in charge today, exactly, as it should be. So welcome back to some of you. Our breakout rooms are going to be closing in just a moment automatically. So as soon as everybody gets back in, we will get started with our discussion. So hang in there with us for just a moment. It usually gives people about 60 seconds before they auto close.
I love these background. They just have their whole business card like just behind them. Patrick's is like on point. His whole back.
He is
Like,
repping
like,
LABBN
repping.
hard today.
Yuli has her whole background.
Oh, no.
Like it.
Hey, so that looks like it. That looks like everybody's back. So talk to me. Tell me how it was. How was it to look in somebody's, or to have somebody, let's start there, have somebody look inside your refrigerator?
That was awkward.
It was awkward.
Yeah, it's like, okay, you're gonna look in my refrigerator? Oh my goodness. But I had no problem with sharing. I opened it and just kind of share what I had in there. But it did feel kind of like, oh my goodness, that's so private. So like,
I love it.
yeah, it's something that you kind of like, you see like it's your privacy, right? Because
Right.
you want to show people what you eat, what you have in there. And like you said, beer. Fortunately, I didn't have any beer there, but
Or unfortunately.
oh, unfortunately, yeah, I don't know where to go.
I've never had a beer in
Yeah,
my life,
definitely.
so I'm just talking because I've never actually even had a beer. But
Yeah. But
sounds
it is
like
definitely a different feeling. Like, oh wow, okay, let's do it.
Yeah, okay, so let's do it. Feels a little bit vulnerable. Who else would like to tell us about how it felt to show somebody in your refrigerator?
I think for somebody new, like meeting somebody, I'm like, oh, this is my
Andrea.
refrigerator. Like that was a little like, okay. But I mean, like I was telling Shayla, who I was partnered with, I'm like, I feel like with my team, since we're all working from home, like we take each other around like in our house. Like so like if it was somebody in my team, like I would be like, oh, you know. I mean, I showed my fridge, but I'm glad it was organized because I just went grocery shopping. So it wasn't a mess.
So you feel like you lucked out because maybe somebody else didn't feel like they had time to prepare for showing somebody something that was so intimate to them. Anybody else want to tell us how it was to have them look inside your refrigerator, things that were going through your mind?
I showed my refrigerator and I feel like at first I was like, oh, okay, my fridge, let's see. But I went to Trader Joe's this morning, so it was kind of organized.
yeah.
It was a mixture of oat milk and beer right next to each other and eggs, and just it looked okay, I guess.
Okay. So what I'm hearing from you a little bit is that all of you have kind of said, well, I'm glad that I was able to, maybe it was a little organized, or that I had just gone to the store. I know the person who showed us their fridge had said like, well, I had just come back from a trip. So I was glad I had a chance to go to the store and there were some things in there. And there's kind of this idea of like, what's the other person expecting? Like, am I showing them all of my beer? Are they okay with that? Or do I have fruits and vegetables? Is everything in there healthy, right? There's a lot of shoulds around what should be in someone's fridge. And so how did it feel to ask somebody to please show me your fridge? For those of you that were the askers. Nobody? Are you gonna make me call on you? Somebody step up. Tell me, how was it to ask somebody? Barbara.
I would say yes, that's the right word. It felt like I was looking into something that's very intimate. It even felt awkward for myself, like, oh, and in the same way, I did not want Elizabeth to feel judged, like and yeah, I felt like, oh, wow, it feels weird to look into someone's fridge and yeah, it did feel very intimate.
So Barbara, you were paired with Elizabeth. And Elizabeth, did you feel like Barbara was judging you the whole time she was in your refrigerator?
Not at all. No. She asked me, oh, how do you like that oat milk? And I was like, I love this oat milk. So no, I felt once she made that comment, I felt very comfortable.
Okay, fantastic. So what are some of the other things you all heard that made people feel a little more comfortable around the experience of vulnerability? Not a lot of talkers today, Brandy.
I heard just from them talking, maybe they can elaborate on it. A lot of them talked about that they got a chance to prepare a little bit in advance, and so that made them feel more comfortable. I don't know who else felt that besides the ones who already spoke up, but I can imagine I have not done any grocery shopping, and so I would not want to show anyone my refrigerator. And so how that might play into it. I'm wondering if there's anyone here who didn't get to run a Trader Joe's today and showed the refrigerator and what they might have felt about doing that.
Sure, I'll take that one. So I have this rule. I'm not from LA, I'm from the Bay Area. And so this past weekend was Mother's Day. And so I drove home this weekend. So I have this rule with my refrigerator that before I go on a trip, like I can't leave anything in it. Like it has to be empty, no leftovers, no like fresh fruit, like nothing, because it'll spoil, obviously, the longer I am. I'm gone. And so that's what I had to explain, like no, like I have food, but like it's not here because of this, like, so it was kind of weird, like, and I literally have a grocery list sitting right like on this Post-it note right here that I was like, okay, after work I'm gonna go get groceries. And I was like, damn it, I should have did it on my lunch break. But that feeling of just like unprepared, but like, wait, let me explain myself. Like I have groceries, but they're just not here, but I have them, so that was different.
So Patrick pulled out his whole grocery list for us.
Like, here are my receipts. I normally have groceries. Anyone else like who wants to admit they didn't have any food?
I follow Patrick's suit, except I have no excuse. My fridge is generally very empty. My parents call me like a European food shopper because I shop by meal, or I'll go to the grocery store a few times. I mean, I'll prep some stuff, but it's never full. It's definitely not like the normal fridge. So I didn't even get up to show anyone my fridge because it looks like it's a single person's fridge, so it's stocked in a very different way. Patrick knows what I'm talking about in some sense here, it is what it is. But I was definitely pulling out my cards of this is just kind of what I do. I don't my fridge is never full of stuff. If I need something, I just go across the street. So
okay, so interesting that I heard Charlene say is that it's not a normal person's fridge. I don't know Charlene that well, but I would venture to say she's pretty normal. Her fridge is pretty normal, probably how it is, but you can see that we all have this expectation around what something as benign as what's in our refrigerator looks like, although we find it's not benign at all. It actually says a whole lot about us, and sometimes nothing at all about us. And yet it's just incredibly, incredibly personal. And so we do this activity, if it wasn't obvious already, to talk a little bit about how our clients and our participants may feel when we are coming into their personal spaces, whether or not those are their physically personal spaces or their emotionally personal spaces. That sense of vulnerability, what informs the things that we show people, whether we've just been on a trip, whether or not we have You know, our personal, our cultural, our entire histories show up in our lives in different ways. And so some of the things that you all felt, your clients will be very much feeling too as you enter into these virtual spaces with them. And for those of you that were doing the asking, you are likely very familiar what it feels like to feel just as awkward asking someone to show you something that's really intimate. And so we heard just a couple of things. I think Elizabeth and Barbara had it down of things that you could do to make somebody feel more comfortable. But that's a lot of what Brandy and I are going to be addressing in this first section. Okay, so creating safe spaces. As you can see, anytime that we're dealing with vulnerability, it's incredibly important that we define a safe space. And before COVID and before everything went virtual, we were really able to do that a lot through our physical spaces. So we invited somebody to our office or we knocked on their door, and just them knowing when we were going to come and opening the door was in a way providing safety for them. Or when they showed up at our office and we were able to shut the door and they were able to see what was around them. But when you're in a virtual space, we haven't created any of those things. And so it tends to be a little more awkward. So the first tip that Brandy and I would give around creating safe spaces, which are so essential for being able to move in vulnerability and change, is to set your intention for the session. So for those of you, this may sound a little woo-woo for some of you. I don't know how many people are Oprah fans on the line, but I love me some Oprah. And you will often hear Oprah say that setting your intention will dictate every outcome. And I completely agree. So setting your intention before you even start your virtual assessment is going to be essential. Additionally, you want to make sure you are introducing yourself. So my name is Hannah. I am an IBCLC. I will explain my scope. This is what I'm able to do. And you may consider talking a little bit about your positionality. You may do this overtly by telling them a little bit about who you are and where you come from, a little bit about your training and your approach, or you might do this a little more subtly, the way Brandy and I did by showing you into our personal lives a little bit, letting you know that we are both mothers. That we both have multiracial, multi-ethnic families, that we both absolutely feel really passionately about maternity care and work in Los Angeles. You want to create a virtual container. So for example, if I'm going to be doing a consult with you here at my living room desk, I would want to let you know that I'm going to put in my earbuds. No one's going to be able to hear what you and I talk about. That the door is closed around me, so nobody's going to be walking through and seeing what we're exchanging visually. You want to make sure that you are centering your client's goals and establish your shared decision making. And this can happen through casual questions. So what are your hopes for our session for today? How can I help you get there? Right? So let's start off where you are instead of where I need you to be. Brandy, did you want to add in before we move on?
No, the part that you talked about, just the shared decision making, that sometimes we can get so much into like, these are the things that I have to check off. These are the things I have to do my paperwork. And sometimes we miss that step of the shared decision making, meaning what is the client's goals? What is their intention for me having me come to their space? And sometimes we have to just be mindful to slow down enough to make sure that we tackle that for our clients. That's the only thing I would add to that. So what I like to do when we start at this part of the training is to kind of just check in with all of you. I think at this point, I feel like we've been in pandemic for 3 years, but it has not been that long, that many of us are aficionados when it comes to Zoom and doing all these things. I'd like to check in. How is the pace for you guys right now so far? You've had an activity. We've talked a little bit about our intentions here. Can you just either put in the chat or you can unmute yourself and just tell me, how are you so far? We're already 40 minutes-ish in. How is it for you so far? I'm gonna make you guys talk no matter what, so somebody. Let's see, I don't see the chat, let me see. I know Patrick has to say something. People from the Bay Area always have something to say. And I can say that because my sister lives in the Bay Area, Patrick. So we have a Bay Area, Southern California rivalry going.
I'll unmute then. I was putting in the chat that this training has me itching to go to the grocery store now.
Feeling good so far. The pace is good. So the first step in building rapport is checking in, as I just did with you all. Again, oftentimes we have an agenda. We show up to a consult. You know you have so much time. You might have 10 to do in that day. And it sometimes can be hard to show up to each one, focus on that individual person's intentions, their needs. An easy way to refocus ourselves in that work is to check in with them. You know, how is it for you right now? Is this appointment still a good time for you? I know you have your older children. Do you have someone who's going to be able to watch them during this time? Check in with them is the first step of building rapport. So for example, we saw with Elizabeth, and I'm sorry, I don't know who it was that was her partner, had said, you know, how do you like that oat milk? This idea of creating some conversation and engagement around things that are actually in that person's life that are important to them are kind of the first stage in creating that level of, you know, you've created the safe space. Now you have to build rapport in a short period of time. I would imagine for many of you that are doing home visiting, your sessions are probably anywhere from 30 minutes to an hour, maybe longer, maybe not. And so you don't have a lot of time to build that rapport. And so simply by taking 2 minutes to check in with them and not just doing, you know, you've been to those consults like at a doctor's office or something where someone just looking at a paper, checking off, and they don't really see you. And we know that people will feel more open to being vulnerable. They're going to share more and feel like if they're actually being seen and not just like someone you're checking off. So you're going to check in with them. How are you doing today? If you know anything about their family and their children, you know, last time I talked to you, Alyssa had a cold. Is she better now? A little bit of something to have them be a person and not just be a client that you're checking off on your list. And people can feel that. We've all had situations where you went somewhere and the person was talking at you and not with you. And we know that doesn't feel good and it doesn't set a great ground for building that rapport. The next step when we're working with families, particularly in the virtual consult, is to figure out what has worked for them previously. It can be really easy, again, to go into the list of resources that we want to give or what we think the problem is. But what can happen when you do that is they will come up with like, oh, yeah, the last person told me to do that and it didn't work for me. And so if you can simply ask them, what worked for you? Thinking about on Zoom calls, I would probably say most of us probably have done 12 million in the past year. Think about give me some things in the chat that worked really well on Zoom calls and things that didn't. I can say for me, one thing that doesn't work well is someone who just speaks for 45 minutes straight and you're listening to one person talk on and on and on and on and on. Doesn't work. You know, so if you can have that conversation with them at the beginning of your consult about really what worked for them, like I had someone come and help me with breastfeeding, but this happened. Or at the hospital, when I was, you know, working with a nurse, it didn't work because we didn't speak the same language, and that's what went wrong. If you can ask some of those questions, it's going to help you to curate and customize your consult in the moment for that client to make it be more effective for them. And again, you create another space where they're feeling really seen and validated and heard. You know, how many times have you all done consults and someone talks about like a previous visitor that might have come to their home and other interactions where they felt that they were judged or they felt the person was racist or whatever. If they have that space to be able to talk about those negative things that happened in previous consultations, it's going to give you the space to be able to help them better. And so you want to think about that. So I want you guys to take 1 second and just write down 30 seconds max. Think about a time where you went to something and the person didn't check in with you and gave you the same advice you got before, or something that so-and-so already told you and it felt like a waste of time. Everyone has that one thing that happened to you. Like you went to someone for some advice and they didn't give you a chance to talk. They just started talking at you and told you things you already know. Anyone have any experiences like that? It could be anything. You went to your CPA, whoever. Let me see, what do we have? Anyone in the chat going to tell us a situation where that happened? Because I want you to, from that, give me a word on what you felt. You might not remember the details, but you remember how that made you feel.
I had that happen recently, and I felt like invalidated, I think would be the word I would use, and probably frustrated too, because I had to go through the whole story again. Like, no, I know that's not what's wrong. I already went to somewhere else. They told me it's something, and I had to go through it all, and I felt like I wasn't being listened to.
And as home visitors, often I'm assuming a lot of your clients are probably working with maybe even more than one agency besides the one that you're working with. I can remember as a social worker, I would be seeing my client. They might have a home visitor that was seeing them. They might have been in a full service partnership and they had that person. They might have had an early interventionist working with their child. And so it's not just us that we're thinking about. We have to be thinking about that they're coming into contact with a lot of people within our field that are having these, experiences with them. And sometimes they're not positive ones. And so we do want to give that chance for them to be able to say what worked and what didn't work for them, because it also creates a lessening of the hierarchy. Because a lot of time what happens when we're feeling awkward is that, particularly for the families that you guys are servicing, is that they see you as an authority figure. So it's like big brother's coming to look in my refrigerator, or at how my kids are dressed, or how clean my house is. And these little details, by asking them, like, I saw that you did a consult before. Tell me how that was for you. Is there anything that stood out that really worked, or something that you didn't like about it? Or I saw in the intake that you said, I want to see anybody but X person. Can you tell me about that experience? And so part of that, again, first checking in, reviewing the previous care, what worked and what hasn't worked. And the next thing is the assessment piece. Because you're home visitors, I'm going to imagine that most of you are probably pretty good at taking an assessment. It's probably a lot of the bulk of how you decide what resources you're going to give, how you're going to approach a client depending on what the different issues are. But a lot of times what's missing from that assessment is connection. We don't want people to feel like we're checking off boxes and just getting our paperwork done. What can you do in your assessment that creates warmth, that allows for a more personalized assessment? Ask about their birth experience. If they have a partner, ask how the birth experience was for their partner. Have they talked about it? If they're living in an intergenerational family, what does that mean for, like, grandma? Was she involved? Is she going to be a part of the childcare? Be really mindful to ask questions about them and their person and their life, and not just the questions that we need to be able to fulfill the contract of our agencies. And so that's when I talk to clients from a social work perspective, a lot of times what they talk about, what they don't like about working with social workers or visitors, is they do feel like they're being kind of shuffled through a system, and we don't really see their family or the stressors that are upon them. And so thinking about someone coming into your house to look at something as intimate as chest feeding, we want to make sure that we're taking that time to make it warm and personable. And so it might mean that you ask about other children in the home. You ask about, how their birth plans differ from what they wanted them to be. Add something to it that adds a personal feel to it. And it's really one of those great foundations of building rapport very easily in a virtual consult. Anything you want to add, Hannah, to that?
No, you absolutely covered it.
Anything you all want to add to that? We're going to make you talk. Don't worry. I'm from Texas, we talk, so you guys got to talk too.
I just wanted to say that I feel like I really appreciate what you were saying, because I've been struggling with that, with just finding that balance. I just enrolled a new client, and I am taking my time a little bit more with the things that we have to do, because I'm asking more questions to try to really get to know the family. But it really is hard to balance it.
Yeah, because I tell people, if you're not sure how to make connection, think about how you can get curious. Like, curiosity can often lead to connection. Like, I'm curious about your children. I'm curious, and I'm not saying nosy, I'm meaning curious. I'm curious about your children. I'm curious about your birth experience. I'm curious how it is going from 2 kids to 3 kids. That can create connection.
Yeah, I'm great at, like, asking the questions. I just always feel like I have to justify it when I don't have like all of my documentation done at this certain particular time. And that's the part that is like a struggle. But, you know, it's just about having conversations and having like those, I guess the expectations, you know.
Right.
Yeah, just having conversations with supervisors and managers and everything too, just to let them know like this is, you know, for me, it's part of the process.
When we did home visits as social workers, we had a acronym that we would say we said COWS. Does anybody know what that means? The COWS? Crisis of the week. And so you can go with your intention about what you're going to talk about. But if a client has the crisis of the week, that needs to take center stage. We're really talking about seeing, validating, and hearing our clients. Maybe I came there to talk about breastfeeding, but your eviction right now is going to trump that. And we're going to talk about that. You know what I mean? And yes, we have to get our paperwork done. But if we're really talking about seeing this with the human lens, seeing this in a way that we are building engagement and rapport and doing it in a way that creates connection, you have to allow for those crises of the weeks to float to the top. You know, if someone is having something that is kind of those basics of, you know, food, water, shelter happening in that moment, and you happen to be the person that shows up on their, you know, virtual doorstep, we have to leave space for those things to happen. And so part of getting better at this is that you sometimes know how to get those questions that you have to have answered for your paperwork to be in compliance with your organization, but also allowing people to have that space to talk about those things that are having a lot of meaning in their life right now. The surest way for you to break that rapport and connection is to gloss over it and don't give people that space or make them feel like you don't have time to discuss that crisis that is coming up for them. And if they're wanting to share that with you, that is your chance to build that, you know, bridge and connection. And so the way that you can manage that, if you do have like these things I have to get done because this allows us to be able to provide the resource to this family, then you can say, I really, really want to dig into this more. Would it be okay with you if I asked you these 5 questions? And then I really want to ask you about this because this sounds really important. And so you're able to laser in on the fact that what they're talking about is really important, but you can be really honest in telling them that I have to get these things done so I can be able to better help your family. But I definitely want to hear about this thing. It's important so that I can see how I can best help you. And people are going to be okay and be open to that.
And you know what, Monica, on a logistics level, you know, this is, I think, a lot of home visitors and social workers, lactation consultants. I mean, pretty much anybody who doesn't have 100% free reign of what you ask, the time you spend on it, and all day to do that, runs up against the problem that you were talking about. And so part of like logistically a way around a little bit to kind of marry what Brandy's talking about and what you actually have to do is to know your intake forms so well. This is one key piece of being able to provide what Brandy was talking about, of that kind of warm and interactive assessment with a client, is to really know what are the things you should be listening for, because we actually hear a lot of intake information or a lot of the things that need to get documented in casual conversation. And so we have to know what those things are to be able to catch them during our casual conversation so we don't have to spend time going back to them. And that's just one tip. I'm sure you do know your intake forms very well. But that's just one tip I found over the years. That's something that's been really helpful for me.
Thank you.
Okay, anyone else before we move on a little bit? We good? I'm gonna keep checking in. How is everyone? You're still awake? Does anybody need a Snickers bar or anything like that? I can give you one virtually. I see a thumbs up from Patrick. He's found those emojis. I'm feeling it. I'm feeling it. A thumbs up from Yulia. Okay, you guys are awake. You're still with me. So, you know, part of engaging with clients, something we're going to talk about next in this virtual consult, is really being clear about what you see is going well. What I see really going well, for example, in this space that we're in now, is that you guys are still smiling. You have your cameras on. No one's asleep. You guys haven't left and said, we can't take this workshop anymore. That's giving me some idea that like, okay, maybe this is going well. You're not bored. You might be enjoying this. You might be learning something during this time. And so when we're talking about doing this in a consult with a client virtually, You want to be talking about with them, what are they doing well? I don't know about you all, but in specific to your roles, what your visiting purpose is. But I find that in general, when we have visiting happening either on a social work side, on a early intervention side, a lot of those families have had a lot of focus on the things they've done wrong. And one easy way for us to engage with our clients and to empower them and to create real bonds and connection, even if they are our clients, is by really being clear about the things that you see that they're doing really, really well. A lot of adults, families, and children don't get a lot of praise for the things that they're doing well. They're only being focused on, that they neglected them or they have concern about how they're caring for themselves and their children. You get to be the person that goes in that space and being really specific about, I see that last time you said that you were having trouble with getting the baby to eat for 5 minutes, and wow, you guys just did a 10 full minutes uninterrupted. And I want to be really clear the difference between praise and descriptive praise. A lot of times we think about praise just giving people like a high five and pumping them up and motivating them. But with descriptive praise, we're really talking about being very concrete about something that you can see that may be an improvement, something about how they're dealing with their baby, something about how they're managing a difficult relationship. You're being really specific about an actual behavior or something that you've seen. And so I remember last week you were telling me that you had a lot of difficulty not having arguments with your partner. And then I see on your intake here, you said you guys only had one disagreement and you walked away from it. You're being very descriptive about what they're doing well and how they've improved. If your job and your visiting role is to just go in and to provide the lactation specific support, then you can keep it to that. Like, what have they improved in, particularly with lactation? If you have worked with clients who have had issues with lactation, if you personally dealt with it, if you've had a partner to deal with it, one of the big things that come up a lot with that is shame. People feeling like they don't have enough milk, or the baby doesn't feed well with them, or they're doing something wrong. And so if you can come in, a great way for you to engage with a client is being really descriptive about the things that you see that they're doing well versus focusing on what they're not doing well. And I can give you guys a really great description of someone who did this really poorly. So like I said, I've been a postpartum doula since 2001. And I once had a client, she had birthed twins. They were born at 38 weeks, really tiny. They're about 4.5 and 5 pounds each. She was really dedicated to wanting to breastfeed them. At this point, we were 1 month in. She was pumping 12 times a day, putting them to the breast 12 times a day, and basically surviving on 3.5 to 4 hours of sleep in a 24-hour period for a full month of time. And we were having to supplement them because of their size, and she didn't seem to be, increasing her supply. And so I encouraged her to go see a board certified lactation consultant. I was not one at that time. And so finally she acquiesced. We went into the office. She's sitting with, the lactation consultant tells her, she never makes eye contact with any of us. So she has her paper. She's telling them, oh, they haven't gained any weight. Okay. And so she's never making eye contact. Everything that she said was like negative things. One, that the mom was obviously clearly aware of. They weren't gaining any weight. She puts one to the breast. She weighs the baby afterwards. Oh, you don't have any milk. The baby's barely got anything in. Something she obviously already knew. That also was something that was very negative. She ended up feeding the other baby, same feedback. The babies aren't getting anything. And then the mom mentioned, she asked, what type of formula are you supplementing her with? And the mom said at this point, I think it was Carnation Good Start. I don't think that's the same name of it now, but she said, they're a Nestle company and Nestle killed 6 million babies in Africa, was the next thing she said to this mom. And the mom at this point was just like, no, I didn't know that, that's just what they told me at the pediatrician's office to get. At this mom, I could see that the mom has now checked out. Like, she's no longer in this consult. She's kind of just going through the motions. And, at the end, she gets the bill for the 2 because she had to pay times 2 because there were 2 babies. You can try that. I don't know that you're going to make any milk, but you can try this. And that was the advice. We went to the car, the mom burst into tears, and she never tried to nurse either one of them again. They went straight to formula from that point forward. And so thinking about all the different ways that she did not engage with this mother who was so dedicated to wanting to nurse these 2 twins, it could have looked like, wow, you've been nursing 12 times a day and pumping 12 times a day, you are so committed to making this work for your babies. Think about that versus, yeah, I don't think you're gonna make much milk. Even if that is true, because she might have had some issues. She did have IVF and had some other risk factors that were risk factors specifically for her maternal age to be able to produce more, and there were some complications at the birth. But even having heard that first, and then someone saying, you know what, I never want to say anything's out of the option, out of the cards, but I want to tell you from what I'm seeing, these might be some of the things that we might experience. Let's try this and see what happens. And so I want you to be thinking about that part of engagement. The reason we're talking about descriptive praise is to provide that positive foundation, regardless of what news you have to give to the person after that, or if they're struggling with the techniques that you're giving them. If it's layered with that really positive part of what's going right, it's going to feel differently for them. We can then normalize their feelings, which is really important. Maybe they don't feel good about what's happening with the lactation. Depending on what their history is. I've had some clients who have experienced childhood sexual abuse, and they had to normalize feelings that they didn't like breastfeeding. It didn't feel good to them. They felt very triggered by it. While they see other people that love it and enjoy it, and they're having this amazing space with their child, they're struggling with what that feels like for them and feeling bad that they don't have those feelings. We want to create that space to normalize conversations like that, normalize having feelings that seem like they aren't, something that society would say would be the correct or normal feelings that everyone else has. And the way that all that happens is through active listening. And so while we're providing that descriptive praise and talking about what's going well, talking about the things that they have been able to accomplish, normalizing feelings they might have about the situation, about how well or not well they're doing, we can really get a lot of that through our active listening. And so with active listening, it's going to be part of that. Once we've built the rapport, you've actually created a space where you're not talking and they're able to share what this experience means for them. There you'll be able to actually have the engagement that opens up your ability to provide them with the adequate resources, the kind of support that's going to be something that they can actually use and hear for themselves, as opposed to necessarily what you came in with, like, this is what my consults look like, this is what I do, this is my formula. I want you to think about having like your flexible formula that sometimes gets reimagined after that engagement phase. How does that sound so far, everyone? Good.
Okay, so who is awake and ready to practice?
Enough of us talking, like we said. It's our time to engage with you. Who's awake? Give me a
Ready.
thumbs up.
Thumbs up.
Your thumbs up. Elizabeth's awake. Brittany's awake with her cute braids. She's summer ready. I'm on my way to you, sister, getting summer ready too. Barbara has a thumbs up. Miriam has her thumbs up. Okay, Yvette's awake. I think everyone else is awake. Sounds good. So we're gonna have a little activity. And so who can be, if you're willing to be a volunteer, can you raise your hand? Because we're gonna practice what we've talked about, creating the safe space, building rapport, engaging with clients. There's not gonna be any gotcha. We're not gonna make you do any calculus or anything like that live on the Zoom. It's all the things that we've talked about. Things that are already in your wheelhouse as home visitors. Who's willing to, I can't see all the screens, maybe you can see too, Hannah. You can either
I really want to challenge you too. If you're somebody who's thinking, maybe I'm not that good at this, right now, this is the time. We don't practice on clients. We practice on each other, with each other, right? This is a safe space for us to kind of show up and get your questions answered. You show up here for a reason, right? You didn't show up here because you already knew all of it. That's my guess. So we really want to challenge you to kind of show up and practice the skills while we have a chance.
Who's willing to practice? Who's willing to be the Zoom home visitor expert extraordinaire? We'll call on you. I have no qualms.
She will too.
You can opt out, obviously. They call on you and it's a no. You can opt out. And they're gonna make us call them then. And I always call on people based on like really strange things. Like I like the color of your shirt kind of reasons. Brittany, I like them braids. You might get called on, girl. I like smiles. Who else? Let me see. Who hasn't spoken? That's probably a good way to go. And maybe you're not.
Miriam has her hand raised, so it looks like we have a willing tribute.
Yay! Thank you. We don't have to pull yet, but somebody's gonna get called on. I know it's gonna happen. Miriam, are you ready and willing? She's like, maybe. Okay,
go ahead and unmute yourself, Miriam.
Let's do it.
Okay, great. Thank you, Miriam. It's always hard the first one. You guys will see it's not that scary, and hopefully some will come afterwards. So we're actually going to do a consult, but I'll let Hannah explain it.
I was going to say, what you might not know is that in this cohort of 28 people, there actually is a mom who signed on to practice with us. And so Ellie, if you would unmute as well.
Hello.
So Ellie kindly offered to allow you all to practice some of your skills with her live during our workshop. And so the skills that we're going to be focusing on right now, Miriam, are very specific to the ones that we just went over. So we don't need to see you do absolutely everything under the sun, but we do want to see you focusing a lot on creating a safe space for Ellie, on building rapport with Ellie, and on engaging her through the ways that Brandy went over just now. So you can do that in any format that you like, but we will kind of just see how it goes and troubleshoot it together.
So imagine, Miriam, that like you guys are on your virtual consult Zoom, you showed up, here she is. How do you begin this process using kind of those steps that we talked about so far? And no perfect order, however you want to do it.
Let me transform.
Yeah, transform. Put on your home visitor page.
Right. Hi, Elizabeth. How are you doing today?
Hi, I'm doing okay. I have two sick little ones, a 3-year-old that has a cold and an 11-month-old. So I'm trying to survive today.
It sounds like you have your hands full right there with 2 little sick ones, right?
Yes.
So how has it been like these past few days that your kids have been not feeling well?
I couldn't hear you. Can you repeat that?
How has it been these past few days that your kids haven't been feeling well? How has it been for you?
It's been a little tough. They've been sick since Mother's Day. My 3-year-old had a croup, so it gets tough at night, especially my husband is a fireman, so he's not here for 24 hours. Thank you, puppy. He said Happy Mother's Day to me.
Oh, that's so sweet.
So it's been rough. But I'm making them some caldito de pollo right now, chicken soup. So we'll see if they start feeling better today.
Great. That sounds like you do these things for them to be feeling better. It sounds like, your husband works a lot. He doesn't spend a lot of time at home with you. And you seem to be working through it, right? And just trying to make it work for you and your children.
Yes, definitely.
Okay, so I need help here.
All right, so we need to call in another volunteer. Miriam, you were so great.
That was good.
Start this off. That was fantastic. Very, very warm. But somebody throw Miriam the assist, please. Come in here and help out.
Who can jump in?
Yes.
Come on, don't leave Ellie hanging here.
Don't leave her hanging. She's these kids. She doesn't have time to be waiting for this long consult. Martha, would you mind giving some assist to Miriam? And helping our Elizabeth? We've already had a little bit of a check-in. So we could move to some other pieces. How might you do some of the things that we talked about, whether it's, engaging, building rapport, start off where Miriam finished.
All right, so Elizabeth, I'm kind of interested in hearing what you're hoping to get out of our session today. I'd like to talk about your goals and how we can work together to reach those. So what brings you here and what are you hoping to learn today? What are you hoping to get out of this session?
Okay, so my little one that I breastfeed, she's 11 months old, and I'm kind of struggling right now because I want to wean her off, but then I don't want to give her formula, but I don't want to breastfeed her anymore because it's been tough. Just at night, I'm up all night, tossing and turning from one breast to the other. So I don't know what to do right now. I'm just stuck. Okay. And I feel like I struggle with this with all of my kids. Like at one point, like once they hit 9 months, I want to give up breastfeeding, but I don't. So I just need a little bit of encouragement from you guys to keep me going.
Okay, so it sounds like you had a lot of experience doing this before and you're really committed to finding something that works for you and for your children. And I think that's great that you're really working on finding a balance between the two, but sounds like you need a little bit of support because you're ready to switch and it's not working for you anymore to continue breastfeeding, but you're not really sure how to get to that point, right?
Yes.
Okay. All right. And in the past, have you ever had like a consult with other lactation consultants or have you received any support? What about that has worked in the past or what's your experience been with that?
No, I've never received any consultant, or I've never been with like a breastfeeding consultant or anything like that. With my oldest, I was 18 when I had him, turning 19. And now that I'm 30, and I look back, I'm like, and I breastfed him for 12 months. I look back and I'm like, wow, how did I do that? Like nobody told me that breastfeeding was good or that to keep breastfeeding him. So I actually wish that I did get the help because even though I enjoyed the breastfeeding part of it, it was still a struggle for me being that young and not having that support from another woman, you know, or anybody pretty much. So yeah, it just went off since I was like young.
Okay. Do you guys want me to keep going?
You know, we might take one there. Okay. That was
Thank
great.
you, Elizabeth.
So Ellie, thank you so much. We're gonna have you pause here too.
Thank you, Ellie.
Ask for a little bit of feedback, but if you need to tend to those kids, please feel free to do that.
Okay.
Ellie's gonna be back with us, or she's gonna stay on, hopefully.
I'll stay on, but I'm gonna mute myself.
Okay, beautiful. What I would love to hear from all of you before we go to our break is what worked, what didn't work, what are we missing? What did you hear?
Start off with the descriptive praise. What did we see our colleagues do that were on that list? What did Miriam and Martha do that were along those lines of creating a safe space, building rapport, engaging? What did you guys see or hear them do really well?
Miriam was really able to bring in and engage like about her kids. So building that rapport with her. I liked how Martha started asking her about what things have worked in the past. So kind of getting an idea if she's worked with anybody in the past before. And she mentioned she hasn't. So it kind of gives us an idea like, okay, let's kind of get more of a history here as well.
And Terry said in the comments, Miriam checked in with Ellie and asked how she was doing. Yes, there was an immediate check-in. Terry, I'll say Martha wanted to work on a plan to continue helping her. It was very concrete, like, what do you want to get out of this? And what would you like to see be the outcome? We heard that very clearly. Anyone, I want to add some other things that our two colleagues did well. What did you hear? What did you see?
Miriam, I was going to share for Miriam, she kind of like similar to what Terry said, she checked in with Ellie, like, sometimes it's easier to redirect our questions. Also, tell me about the kids. And then we forget about the client, right? We missed that opportunity. And I liked how Miriam stuck in checking in with her. And maybe that can come later, right? As the conversation keeps going, but it stayed about her. And then Martha brought in about her previous experience. So talking about her strengths, reminding her, you have strengths, you have experience, right? So tell me about that. And so I thought that was also a great point that she brought to the conversation.
And I want to say Yuli just had a really amazing point that she made. How many people here are parents? Raise your hand if you're a parent. How easy is it for you to focus on your children and not yourself? Raise your hand if that happens to you often. And so what you brought up was something really important, that oftentimes clients will revert right to, my kids need this and this is what's going on with them. And they don't even think about talking about themselves and what needs they have. And so it is important for you all as home visitors, as part of that assessment, that personal assessment and connection, is having them to focus on themselves. Like, I want to hear so much about your kids, but how are you doing, Dad? How are you doing, Mom? Is something that's really important that a lot of people don't give them space to do. So thank you for bringing that up, Ely.
And Madeline says in the chat, reminding parents about their own self-care. And we can make room for that. So to be the opposite of Brandy, let's move on into what you heard. What was missing? What could we add? Nothing. It was perfect.
So Ellie's completely taken care of. Nothing needs to be.
I was going to say, sorry. She said that it happened before around the same time frame. So I think I would have liked to have asked what's happening around this development, right, stage for her children, because it seemed like it happened around the same time, the previous time. So what is she noticing around this developmental stage? You know, are they biting, or is it something that's causing the discouragement to stop breastfeeding? Although she has she's getting pulled, she wants to, but then she wants to stop, but she doesn't want to stop. So I would be curious to ask her what's going on around this time.
Could we normalize those feelings, possibly? That ambivalence about weaning versus not weaning. Yeah. What else was missing?
Maybe acknowledging and letting her know, affirming that it is important for her to breastfeed, yet on the other hand, there's something that it's not working well for her, for the children. So acknowledging that and, just bringing it up and saying, okay, let's see what, it's happening. Like Yuli said, what is happening around that time frame, what is going on. So just validating that it's important for her to breastfeed, yet there's something that it's, for her, it's not feeling right.
And I see in the comments we have Madeline saying we want to be reminding parents about their own self-care. So that's something that we could do, because we hear that this is a mom who has her husband is a firefighter, is an essential worker that's gone for 24 hours. She does need to take care of herself. But just being mindful when we talk about self-care, that we often kind of deduce things down, like take a bubble bath. And it's like, that's good, but what if I can't pay for my lights? That's not going to be very, self-care is a little bit more than what I need. But I think we often get into that. They just tell moms, like, just have self-care, and not the root of like not having support or not having those other essential pieces that go along with self-care. So good, Madeline. And then Monica said we can give ideas about wearing the baby. I think that's what you mean by about wearing. Is that right, Monica?
No, she meant weaning.
Weaning. So she did say weaning. I said wearing. I'm thinking baby wearing.
I meant weaning just in regards to like having a conversation about like different ways, like if she wanted to just explore, like, weaning looks different for different people. And I didn't know a lot about, like the whole weaning process, but, with me just learning more about like breastfeeding, I have learned a little bit more about that. And so just exploring like the different ideas and what that might or could look like for her.
That's great. And then Ashley is saying, I'm also wondering if she has a specific time frame goal. That's a great clarifying question. Or is she open to continuing without a time frame? Like, I want to be done with this by the time she's 12 months old, or I'm taking it day by day. Those would be great things to clarify. And then Martha says, I forgot to set the tone about who I was, what I could provide, etc., and make it more of a collaboration instead of an interview. That's really, really great self-awareness, Martha. Anything else anyone wants to add before we take a little break? Ellie, is there anything that you felt that was missing or you would have liked or you think that they could have asked you about or clarified more based on what you said as the mom in here?
I really like the self-care topic. Like they could have asked me like, what are you doing for yourself? You know, I think that would have been good. So then I can go on like, well, I'm not doing much, but taking care of these children. So yeah. The mom really does forget about herself, you know, like you said, the bubble bath, but I mean, I don't have time to take a bubble bath, you know, or some people will be like, oh, go to the groceries by yourself. Like that's not self-care to me because that's just something that needs to be done, you know? So that's really good. Now I'm going to have to think about what I'm going to do for myself as self-care.
So this is actually a good point.
I think they did great and they're doing well.
Thank you.
Yeah, I think that's actually a really good point. Asking and figuring out what the things that you like doing, right? For example, what that you enjoy doing. And that comes with the conversation and building the rapport, right? Just asking what are the things that you like doing as a family and things that you like doing for yourself. And there's a lot. But yeah, definitely that could have been added right there.
I'm going to add this last comment from Yvette, where she says, you can ask about how she ended up weaning her last baby. Again, that goes back, what worked before, what didn't work, how was it? Maybe what she did before worked really, really well. And we don't have to reinvent the wheel, and she can make a plan for doing that again. I think that's a really great clarifying question, Yvette. And so I like to say before we go to break, how are you? How is this working for you so far?
Are you asking
everyone? I'm asking the whole class, including you, Ellie, if you want to answer.
This is going well.
I see some thumbs up. Okay, good. Good. All right. So Hannah, how long is their break time?
So we have 10 minutes for break. And while you're on your break, you know, this workshop is about, you know, the anatomy of the virtual consult. So I really want you to think about how we were able to create this container together, where we were able to use some of the tenets that we talked about and why that might be important as the most essential foundation to what you're creating with clients when it comes to virtual consultation. Okay, and we will see you in about 10 minutes, which is 2:28. Okay, 2:28, we'll be back here.
See you then.
We just did a time check and realized that we only have 30 minutes left, which is surprising. So welcome back to all of you. Thank you for being prompt. So now that we've already talked a little bit about creating that safe virtual container, which is the foundation from which all virtual assessments work. Without that, you might as well not even try. But once we've established all of those things, now we need to talk a little bit about the technical piece of how to actually assess lactation or infant feeding virtually. Now, many of us are kind of cursing this. So all of you here work supporting lactation one-on-one with your clients, is that right? Some of you, most of you, I see nodding from Charlene. So all of you should be nodding, I think. Maybe. Okay. So yes, you all work in supporting lactation with your clients. And so you already know a little bit about what you would expect to see if you were sitting on a sofa next to them and they were having some kind of a breast or chest feeding issue. The issue is, how does that translate to a virtual assessment? And so as we mentioned initially, it's incredibly important. If we had thought about back towards our refrigerator exercise, what would have made it really easy for you would have been a little bit of preparation. So if we had let you know you're going to come to this workshop at 1 o'clock and everybody's going to look in your refrigerator, right? Instantly, you're going to be able to make that refrigerator just the way you want to present, because you know that it's going to happen. And so prep work is really important to establishing success in a virtual assessment. you want to make sure that you are establishing any angle that's necessary before that baby is insanely hungry. So anybody tried to talk while a baby is insanely hungry and not latching? Anybody had that experience yet? What does it look and feel like? Barbara, you're nodding your head. What does that look and feel like?
Virtually, what it looks like is the baby is crying. The mom sometimes wants to talk over the baby crying. And not really addressing the baby's needs. And so I feel like, oh, I wish I could go there and help her, you know? And so I always put baby first. Would you like to put me down? Would you like to, it's okay, set the baby down, set me down and then tend to the baby. It's fine, you know? Do you want me to give you a moment? Do you want me to give you a call back? Do you want, so I give options.
Yep, well done. So for those of you that haven't had the experience that I know I've had and Barbara's had, it seems like as well, this is often what it looks and sounds like. What? Huh? Huh? What, you want me to what? Okay, no, hold on a minute. Right? It feels insane. And it doesn't just feel insane for the mom, and it doesn't just feel insane for the infant, but it feels insane for the lactation educator as well. And so in that moment, it's really difficult for all the adults to stay.
Maybe lost Hannah for a second.
To establish our angles before we're in this situation. So before we have a screaming, crying baby, we want to make sure, is there any way for us to communicate with this parent about what angles might be necessary so that they are established prior to our consult? So we want to think when we're writing these up or communicating with our clients about where you would stand if you were in person or where you would sit. And that's where your camera angle should be. So if typically you would kind of come in close and be looking above a mom, maybe like this, at the top of her breast or chest area and the baby's face, then you want to see if you can have her establish a camera angle, either with her mobile device or her computer, that can establish this. If typically you do all your assessments one-on-one and this is fine for you, then I suppose we can work with it. But I want you to really think about what are your must-sees. So your must-sees are parent's hand position. So if I have a camera angle that's up like this, and we're trying to do an assessment, this is probably not gonna work so well, right? And if baby's extremely hungry and screaming and crying, and you're like, I can't see your hand, and you can't see your hand, and you already know it takes 6 hands to breastfeed a child, right? It takes 6 hands to breastfeed a child. And so now they're trying to figure out how to move the camera and how to hold the baby and how to hold the breast all at the same time. You really need to be seeing parent's hand position. You need to be seeing from the infant's shoulder to the infant's ear line. This is going to be essential. Who can tell me why this is essential? You all work in early lactation. Why is it essential for you to see from shoulder to the baby's ear line at minimum?
We want to make sure everything is aligned. We want to be able to see jaw movement, making sure the baby's head isn't this way and the body's the other way. So just being, yeah.
Yes, exactly, Brittany. And Ashley said it too, appropriate alignment. So the few things that we're really looking for when we're assessing kind of our basic breastfeeding, chest feeding management is we're looking for baby's position. We're looking for the lactating person's position. And then we're also looking at latch. And we can establish a lot about transfer by being able to see baby's jaw, right? And so when you think about all of those things, where would the best angle be for you to be able to assess those things? Where would you put the
side or above, like you were showing earlier with your camera angle?
Yes, to the side or above. And so that said, it's really, really helpful when you can enlist somebody else to help with virtual consults. And what we know is the reality is not everybody has somebody as part of the picture in terms of co-parenting, but that doesn't necessarily mean that they have nobody in their life at all. And so when we talk about preparation being really essential for establishing good angles for assessment, we have to talk about, have we talked and made contact with this person ahead of time and said, hey, what I'm gonna need to see is an angle of your baby at your breast or chest from here down. So if you think about the way you look down to your baby to look at baby's mouth, I'm gonna need to do the same thing. Is there somebody in your life that you can enlist to help hold your mobile device, right? So that I can see you. And if absolutely not, then shelves are your best friend. So what this looks like, if I can move my records back a little without them falling, hold on. What this looks like is finding a way to, in their house where you can lean a camera off of a shelf and sit underneath it. This would be another way that we can assist in getting an above down angle when we have no one to hold. Some people will be very skilled, of course, at just holding the baby and holding the phone at the same time, but I don't recommend it. It doesn't scream comfort for us. But the other thing you want to consider, right? So let's say we're able to establish all of that with the client. We also want to really remember that when we're talking lactation education and not lactation consulting, you are really focusing a lot on your ability to teach. And so you want to think about your angles for teaching. So you want to make sure, of course, that they're able to see your torso. So you might have to have something that angles you down. It's less important that they're seeing your face during teaching. Much more important that they're seeing your torso. And of course, all of us, if you're working from home, you know, that Zoom outfit where the bottom isn't quite appropriate, that's not going to work for teaching in virtual consults or lactation. We have to wear pants, everybody. Pants for virtual consults, because we are going to have to angle things down so they're able to see here. You're going to need to be in an area where if you are doing a latch class like this, similar to if you were trying to assess latch, this isn't a good angle for people to see what's happening. Are you able to turn at an angle like this to see bringing baby in from the chin to the nose, or the breast angling it up and bringing it down from nose to chin, right? Are you able to establish angles like this where you can talk about bringing in baby onto that asymmetric latch this way? This angle is great for establishing hand position. So one of the things that we see, and we're not going to go over this in this course because we actually are going to do a specific latching workshop with you to talk about how to create a better latch, both virtually and in person. But this angle is wonderful for this. This is what we see all the time. People are compressing their breast this way and bringing baby on like this. And as you can see here, baby's mouth is this way. My breast is now sandwiched this way. Doesn't work. So being able to reach all the way under the breast like this, like the underwire of your bra, compress the breast, tilt it away from baby, and establish that good latch. Okay, any questions on angles, establishing angles for virtual consult with lactation? Let me pop into the chat here. Oh yeah, we can stop sharing the screen, although I'm done now, Arissa, so I guess that's not going to help you very much. Sorry about that. Hopefully I wasn't too small. Everyone was able to make me a little bit bigger. The one thing that I have heard time and time again since the beginning of this pandemic is really about how awful it is that we're virtual and how we wish that we could be in person and we could fix it all if we were just in person. But I really want to challenge that for you. I really want to say that there's actually a lot of benefits to virtual consults. And I know this because I've been doing them for the past year and a half in a way that I hadn't been doing them before. And so some of the benefits and things that really have stuck out to me are, number one, clients are in their own space. And so similar to our refrigerator activity, they're able to set up a space that they want you to see. You don't need to go into their entire home. Imagine if I said, like, clean up this small office space versus clean up your entire home because you don't know where somebody's going to walk. And so they're really able to set up their own space. They're also using the things around them that they are going to be using when they're trying to establish comfort in lactation. And it's important for us to be using those things as opposed to things they don't have access to. Virtual consults are much more accessible for most people if they have internet and a device, which we know has been a huge barrier. But if you're already making contact with them, it's a really wonderful way. You can do these at odd times of the day. You can make them quick. Just as Barbara said, you put me down, handle the baby, come back to it. Right? And they don't necessarily feel all of the pressure of you sitting there and waiting for them to tend to what they need to tend to. You can call them back, right? You can schedule it at a different time. You can involve family members that are in the home, which is a really wonderful thing. So again, from the beginning, you want to enlist people. Who is it who's important to you in this journey? Would you like to have them present? How can they help? Assign some roles from the beginning. Virtual space is limited to what the client wants you to see. So we talked about that a little bit. They don't have to be so worried about you seeing everything. Maybe they're okay with you seeing the refrigerator, but not with the whole kitchen. Client doesn't feel like they have to tend to you as their guest, right? So when somebody enters into their home, maybe they're feeling like they have to get you a cup of tea or a cup of water or make you feel comfortable. But on a virtual consult, that all goes away because I'm in my space comfortable and you're in your space comfortably. And so you don't have to tend to me. The thing that we have to remember about all of this is that all of these benefits that are listed, they can also be drawbacks. So it's really going to be up to you to make them an asset and not a liability. So it's going to be up to you to highlight these for clients and not lead with that intention of like, this is never going to work because it's virtual. And so I might as well give up now. Well, I don't know what I can do about your latch because it's virtual, but if I was there, then maybe I could have helped. And really see that there are all these benefits you can draw from. And if you get creative, that they can work to your benefit. Ms. Jordan?
Yes, and so that brings us to special cases. So when we should be referring out, when it's appropriate for a lactation educator who's doing a virtual consult to be doing continuing support, when that should look like, it should be going in person, et cetera. Let's jump into that. So virtual consults are going to be good for basic latch and positioning. So someone's having a few issues with latch and positioning. They are possibly having some soreness, we'll talk about in a second when it's not good, but that basic kind of things that you've learned, it's in your scope of practice as a lactation educator, it's very appropriate for a virtual consult. When we think about the benefits and the risk, wouldn't we rather have a virtual consult happen versus them not getting the support at all? How many of us, either in person or otherwise, have seen people 6 weeks, 8 weeks, 4 months in, where we know, oh my gosh, had I seen them when they were 3 or 4 days, I could have easily told them to do this. Or if I could just see the latch, I'd have been able to provide this type of support. And so it's very appropriate for most of the things that people are experiencing in those first couple of weeks and months related to lactation that can be helped by being able to ask questions of their home visitor, or virtual visitor in this case, if they're able to show something that they might be like, oh, this is all wrong, and then you're able to give them that descriptive praise about how well it's actually going, it's very appropriate for that. If they are having issues related to engorgement, it's obviously going to be really helpful. You can actually see if they are open to having you see what their breasts look like. You're able to say, okay, this is something that it can be helped with cabbage or with them, doing more feeding at the breast. You can do most of those things from a virtual consult. When we think about what postpartum care looks like in the United States, most people don't have a ton of support unless it's coming from family members. And so think about what that means if they have to have someone, like Hannah was saying, come into their home in the weeks and days postpartum. I don't know what your houses look like right after you had a baby, but I probably wouldn't have wanted someone at my house 10 days into nursing a baby and with small children running around. And so we know that by having it in this space, it provides a little bit more of a playing field that feels more intimate and less vulnerable for our clients. And so there's a lot of benefits to that. And the risk is that they won't get the help at all if necessarily they had to have someone come into the home or if they had to actually go into an office. And so there's a lot of benefits. They actually outweigh the risk of not having a consult at all. We also want to be thinking about not all of the families we're working with are going to be able to solely provide, chest feeding, or do they necessarily want to? And so this will also give an opportunity to talk about paced bottle feeding if they're in a situation where they have to do both. Thinking about some of our families who are going back to work really soon, and depending on what kind of jobs they have, is it practical if they're going to be able to pump every 2 hours when they want to? And if there's a clean place for them to do that? Yes, the law says it should be that way, but we know a lot of people work in conditions where they don't feel like they have the ability to speak up for those needs, or the safety to speak up for those needs, depending on what their status is. We know that there is a lot of discrimination for certain people in their workspaces. They might not be able to speak up about what their needs are, or don't feel like they can. And so we might be actually helping them with paced bottle feeding. Again, it also opens up that chance for you to normalize those feelings, normalize the idea that maybe they didn't want to add the bottle, but it's a necessity for them to be able to feed their children, to keep their job, et cetera. And so you get to do that. So it's great for that. Now let's talk about a few reasons why it's not necessarily a great medium for virtual consults. If there is an issue with milk transfer and it's a high-risk infant, meaning they have jaundice, they were born at a low birth weight, they've lost tons of weight, you can get some of this, I'm assuming, in the assessment that you're doing ahead of time or at the beginning of your time with them. We talk about doing that personal assessment. You know, at the birth, they might have mentioned, oh, the baby was on oxygen, was in NICU. And it'll allow you to ask some more clarifying questions to make sure that this is appropriate to ensure that there is enough nutrition getting to the baby. And so a virtual consult's not going to be great if they are saying, if you're hearing lots of red flags that mention high-risk infant and their ability to be able to actually transfer the milk. And a lot of times, these aren't something that you have to guess at, or we're expecting for you to be able to diagnose whether or not they're high risk or not. A lot of parents are going to be telling you what happened if you're asking the questions. You know, how was their birth? Did the baby have any complications after the birth? Did they lose weight? How much? You know, have they or their healthcare providers had any concerns about their baby's ability to intake milk? And you will usually get very quickly like, oh, they had to have formula at the hospital because he had a really high jaundice. They were really concerned. And when we left the hospital, there was 14% weight loss. You will start to get a lot of answers to those questions. And if you're still hearing that's a concern, then we're going to be wanting to refer them out to services where they're either being seen in person or being referred back to a lactation consultant, a board certified one, or their pediatrician or medical provider. If they're talking about having persistent pain, and then we're not talking about them being, oh, it's a little bit uncomfortable, but after 30 seconds, it feels okay at the breast. We're not talking about that. If they're talking about, ongoing bleeding, cracked nipples, shooting pains, like the kind of pain where they are in tears or feel like you ask them on a scale from 1 to 10, it's a 10 every time, or even in between feedings, I'm in pain. Can you think about a reason why we wouldn't want this to be ongoing if they're saying they have persistent pain? Why would that not be appropriate for a virtual consult? What do you guys think? If you have a client who's experiencing, it cut out, I'm sorry, I couldn't hear it.
Maybe there might be a more severe, I don't know, like a beginning of infection or something.
It could be. I mean, the thing is, we have no idea what it could be on a virtual consult. So I don't know. Do you have a lump in your breast? Do you have mastitis? Do you have some other underlying, something that happened that I don't know about? If they're experiencing any kind of pain that is ongoing, persistent, and is out of the realm of just being a little bit sore when baby is at the chest, then we do want to be encouraging them to reach out to a medical provider and having some kind of in-person exam. And this just wouldn't be appropriate for a virtual consult. In general, it's also about using some common sense. You don't have to be a detective. You don't have to be a doctor to say, like, this baby's losing a lot of weight and this mom is actually saying that she's concerned about her baby's weight loss. Is it appropriate for us to just have this, consult virtually if we are talking about a young child who's losing weight and seems to have had some previous issues as well, or is presenting with them now? Maybe you see a baby on screen that just looks a little bit off to you. This is where we don't want to be like, oh, I don't know, like, I'm not sure. Am I the one to be able to do that? We want you to have some agency because it is more important to be a little bit conservative and maybe jump the gun than have something go missed because you were afraid to jump in. And so usually intuition is actually really, really good. And so if something feels off, you do want to encourage them to say, you know what, the baby's looking a little bit sleepy to me. It could be nothing, but I think it's really important for you to connect with your pediatrician, or here are some referrals for a lactation consultant. Will you be able to call them today? So it's not just about making the referral in these special cases when we're talking about high-risk infants. It's also about incorporating a plan that they're actually going to follow up on it, that it's not really a suggestion as much as let's make a plan to make sure this happens. And that's where sometimes things get left off, where they kind of thought like, well, it was a suggestion, where really there was some actual concern and that we didn't clarify enough for them that it's something that needed to be attended to right away. So again, if they are tracking weight gain and you see that the weight gain continues to plateau or it's going down, then we definitely want to be saying that this is something that should either move to an in-person, or it should go to them seeing, contacting a lactation consultant or their pediatrician to ensure that everything's okay, and them let the doctor say that, you know what, we think it's fine, they don't need these services, we don't want that to come on your backs to be able to make that kind of diagnosis. But for the most part, you can see there is so much that you can do that's going to be super helpful for families. The things that make it not great for a virtual consult are all things related to making sure that we keep parents and babies safe. The other thing that I would mention on here that's not necessarily related to the lactation, but is mental health. We are first responders. When you are seeing someone in these days and weeks after having a baby, and you're able to see them virtually, maybe they're not letting other people into their home. Maybe they're following a 40-day and don't have family members who are coming to visit. If you're seeing someone who's presenting with what you might feel is postpartum depression or anxiety or psychosis, this is also a reason why a virtual consult might be okay for the lactation, but we're going to really encourage them to seek other services if we see something that feels a little bit more acute that has to be dealt with in that moment. Anything else you want to add to that, Hannah?
Yeah, I just want to add that when you're looking at this list, what I hope that you see as lactation educators is that everything on the left that virtual consults are good for is within your scope. So when you know your scope really well, you know that lactation educators are hands-off, and your best strength is your verbal ability and your ability to model using, I don't know, a doll and maybe a breast model. And so we should be able to transfer all of that, to communicate all of that in a virtual setting. What you see here on the right are all things that we need to be referring out to an IBCLC for. So anytime it falls out of the scope of an educator, what we really want to be telling clients is not just, you need to see an IBCLC, but my recommendation is that you make an appointment with an IBCLC to see you in person. And that's a really big distinction, because if they were to call an IBCLC, it might be the first instinct for them to say that they would make another virtual consult, particularly during COVID-19. So it's really important for you to identify for your participants, for your clients, when an in-person is really necessary. If a baby needs to be weighed, you must find a place for them to see that baby in person. That is not something that can be assessed virtually. If the baby's mouth needs to be assessed, fingers in the mouth, then we need to make sure that we're seeing that baby in person. You can actually, lactation consultants absolutely can do oral assessments virtually, but you want to make sure that you let the person know why you're making the referral. You have persistent pain, and at this point, just fixing the latch and positioning the way we have doesn't seem to be taking care of it. So I'm going to recommend that you see somebody in person so they can assess baby's mouth and further assess your breast or chest area. Okay? So everyone really clear on when we're referring out and accessing continuing support? Okay, then we're going to stop that slideshow for a little bit and just get into some questions and answers. We have about 7 minutes.
Y'all, I'm gonna get Texas on you. Just a big y'all. Let's get talking.
Now I can tell you right now that virtual consults and the challenge with virtual consults was something you all said you were struggling with. So we want to hear, what are your struggles? How can we make it easier? We really are here to answer those questions.
Yeah, Hannah, I was actually gonna throw it out to the group as well, because I know, and I'll summarize some of the things I'm hearing, but I'd love to hear directly from staff, because LABBN in no way actually sees clients. But I think some of the challenges that we're also hearing is what happens if when a NICU baby comes home and trying to provide support to a baby who is already having various challenges. The other piece of it is that privacy piece. I think that's still something that appears to be a challenge, but it's almost like a barrier that the client may not be able to address. And so what do you do if there is no privacy in the home, and there's even questioning of the technology that's being used in terms of privacy, right? So we know most sites at this point are using Zoom or Microsoft Teams, something like that, HIPAA compliant, so on and so forth. But there's still a lot of these like tech concerns and all. But those are some of the things we've heard. But I'd love to hear directly from the teams as well, because I'm not sure that every client is also some of that piece about even getting a client to be willing to do a virtual consult, how to work through that piece.
Yeah, I would ask, Charlene, one of the things I would ask here is, what do you all have set up currently in your systems to communicate with clients prior to a virtual lactation consult? So if you know that lactation is the thing you're going to be talking about, what is established already with clients in terms of building rapport and talking about safe spaces? So number one, if that person is already breast or chest feeding, they're doing it somewhere in their home. So where is it that you're talking about privacy issues, right? So you're doing it somewhere. Where is the place that you feel safest to do that? Is there any way that we can do your consult from that space? If we're talking about privacy in terms of technology, absolutely communicating. Number one, first and foremost, I'm not recording you. There's no one else who's going to be able to see this other than me. Even I go so far in my own consults as to actually turn my computer around so people can see like a 360 as to where I'm sitting, because I think it's really important. Like, for all I know, Charlene has 3 people who are looking at her behind her camera, and I have no idea. That would make me feel very uncomfortable if I was going to show parts of my body or even the inside of my refrigerator. So that's a technique that I use in my virtual consults. But also to let people know, I also use the platform Zoom. It's HIPAA compliant. What that means is, and that's really the best we can do in terms of letting people know. People are going to distrust it, absolutely. But letting them know that it's been secured through your network, and that's what the home visiting network has chosen to use, I think will help.
And using some of those tools and asking them what concerns they have, because oftentimes the concerns that we think that clients have about a virtual consult have nothing to do with technology or nothing to do with privacy. It might be that the time you pick is when my mother-in-law is here and I don't want her in my business. You don't know what their reasoning is. We often assume it's different things, but we want to be really clear. I noticed that you were having some concerns about setting up this virtual consult. Would you mind sharing what made you uncomfortable or how we can make it a better space for you? And you might get that information. And so it's just important for us to always make sure that part of that engagement is actually asking questions. We don't have to guess. We can just directly ask clients if something made them uncomfortable, or if they don't feel comfortable with something, would they mind sharing why that is? And then it'll open up that opportunity for you to be able to say, yeah, I would too be concerned about the technology. Let me talk to you about why we chose this platform because of its HIPAA compliance. If that is the actual reason why they're feeling unsafe. I would often say to people, like when I'm at home, like there's no one in my home but me right now. So there's no one that's going to accidentally walk in or anything. I just want you to know that, so you don't have to be concerned that someone might actually become a part of this consult that you weren't planning on being here. So little things like that go a long way. What it really shows people is that you have been intentional about thinking about creating safety for them. And that's what it does more than anything. But that is really, really great point, Charlene. Thank you so much for bringing that up. Anyone else? Our last thought.
I appreciate the tips that you gave about letting the client know it's a safe space, because I do think that is a challenge with them not feeling comfortable to expose themselves, on camera, because who's going to walk past, who's going to see me, and maybe in their own home as well. But usually I think it's more on our end. Like, I don't really know you, you know, who else is going to walk past right now. So I think that's great tips. And then also, a lot of my moms are home by themselves, and the shelf, that thing that you said, that's actually a really good tip, because I'm like, I can't see, like I'm moving around, like I can see better, but that's a good tip as well.
Brittany, also, you often hear me say to clients, like, it's about to be a really weird angle because I get in like this,
Yeah.
and I see as if I can control it as well.
Yeah.
Like one eye in the camera.
I mean, it's really important to think about, like right now, as I'm looking at your background, you're my home visitor, I'm looking at your background. These are the visual cues I get. So there is fluorescent lighting above you and an exit sign, which says to me, you're in a public space, right? And if that was the case, those are the visual cues that I'm getting. There is no way we're even having a conversation about my personal life.
Mm-hmm.
Yeah, very true. So like usually when I do visits, I move to a different space so you can see like no one is behind me, you know, so I do have to like kind of angle myself differently, you know, to let them know that it is a private space. And my manager did buy me a door for my cubicle so I can have privacy, because people do walk past. And that was a huge concern for me when we started doing virtual visits, was privacy. I don't want my mom to feel like I can't help her breastfeed because people are walking past, people are talking, you know, things like that. So and then I also got a little doll so I can demonstrate, you know, things too. So, because that's been a struggle as well. I'm a visual learner and I like to demonstrate, you know, so using a doll has helped.
Wonderful.
I'm actually nursing my 11-month-old, so I don't know if you guys want to use me as an example right now.
Well, my goodness, Ellie, you're like too much. We are just slightly over time. So to be respectful of everyone's time, if you all need to log off, you're more than welcome to. But at this point, if anybody does want to work with Ellie to see whether or not we can establish a good angle for her, nothing better than having someone live to practice with.
Everybody's being shy, running to go get their Snickers.
We're never gonna.
I don't know why I keep saying Snickers. I literally have not had a Snickers since I was 6.
I know, you're talking about Snickers.
Hi. Hi.
All right, well, I think that we will have, our next webinar is in the morning next week. So I hope y'all come with your coffees in hand, more awake, and communicate with us a little better. I want to say a big shout out to Ellie. Thank you so much for being here with your little ones.
Thank you guys for having me.
And helping all of us, you know, get to a place where we can give better care to people we really care about. So I appreciate it.
You guys are all doing a great job. Keep it up.
Thank you, Elizabeth. And Hannah, I just like to end on a woo-woo note, because that's who we are. That part of, you know, all of this that we talk about is really about clients being seen. And no matter what it is that we're doing, we can leave people with a great feeling. And so one of my favorite quotes, and people have probably heard this, is from Maya Angelou. And she says that people will forget what you said, people forget what you did, but people will never forget how you made them feel. And so if you can kind of think about that when you go into every session, regardless of how busy our work days are and how much you guys are being stretched, I also believe that you are essential workers as home visitors. If we can go with that thought about what can we do to make sure this client leaves with a feeling that you cared for them, that you genuinely care about the outcome for them, and just their general overall well-being. And so I think if you lead with that, your clients are going to be very happy and very well cared for.
Okay, you all, we hope we'll see you next week or the week after in one of our additional workshops. We hope you have a wonderful day.
Thank you so much.
Everybody. Bye.
Bye, everyone.